Definitive diagnosis of anemia requires a stepwise approach, and this stepwise approach we forget with time. This clinical video is a small effort to review stepwise approach needed in anemia diagnosis. With these words, I am Dr. Manish and I welcome you all to another interesting clinical video on thalassemia. So let's start. Eight-month-old female child weighing 5.7 kilos presented with complaint of severe pallor noticed by parents over the last 1 month. She was apparently well prior to this observation by parents. There was no history of any acute illness, fever, bleeding from any side, jaundice, and breathlessness. Child was born of a non-consanguineous marriage after a full-term normal delivery. On examination, pallor is present. There is no icterus. Observe carefully. You will notice a marked color difference between my pink hand and baby's pale face. Whenever you evaluate a baby with anemia, always examine abdomen for hepatosplenomegaly. Liver is palpable 3 cm below right costal margin and spleen is palpable 2.5 cm below left costal margin. Based on presenting complaints and examination findings, a diagnosis of anemia with hepatosplenomegaly is made, and this anemia is chronic one, as this child did not present with symptoms suggestive of cardiac decompensation. Whenever you approach a case of anemia, the aim should be to make a definitive diagnosis. With this aim in mind, the minimum investigations to be sent in any case of anemia are complete blood count, reticulocyte count, and peripheral blood smear. Complete blood count of this baby is showing hemoglobin to be 3.9 grams per dl, which means that baby is severely anemic. The next parameter which should be checked is reticulocyte count. Reticulocyte count of this baby is 9%. It should be remembered that when the reticulocyte count is reported as a percentage, it needs to be adjusted for the total number of RBCs present. This correction can be made by multiplying the reticulocyte count by the patient's hematocrit divided by an age and sex appropriate normal hematocrit. So, corrected reticulocyte count is calculated by multiplying patient's reticulocyte count, which is 9, with her hematocrit, which is 9.3, divided by age and sex appropriate normal hematocrit, which is 36, and it comes out to 2.33. Now what does it mean? It means that when reticulocyte count is more than 2, immature RBCs are more in circulation, and this happens in response to blood loss or hemolytic anemia. As there is no history of blood loss, so points are going more in favor of hemolytic anemia. Now, at this stage, definitive diagnosis is established by seeing peripheral blood film and based on findings in it, sending a specific diagnostic test. Now let's have a look at peripheral blood smear. Red blood cells show hypochromia, anisocytosis, and poikilocytosis, many macrocytes and occasional macrocytes with a variable number of target and teardrop cells are seen. There is marked basophilic stippling and variable polychromasia. Large number of early, intermediate, and late erythroblasts are seen. White blood cells are adequate in number and normal in morphology. Platelets are adequate in number and normal in morphology. Blood parasites are not seen. Now let's analyze findings on peripheral blood film. RBCs are macrocytic, which means smaller in size, hypochromic, which means staining less as compared to normal. Target cells denote disproportionately large RBCs compared with their volume. Teardrop cells are pear-shaped RBCs indicative of mechanical stress during release from bone marrow or passage through spleen. Basophilic stippling denotes disturbed erythropoiesis. Polychromasia refers to large bluish RBCs lacking normal central pallor on peripheral blood smear and means rapid production and release of RBCs from bone marrow. Elevated reticulocyte count most commonly seen in hemolytic anemia. Based on findings in peripheral blood film, anemia is going in favor of hemolytic. Hemolytic anemia with hepatosplenomegaly at this age favors diagnosis of thalassemia, so hemoglobin electrophoresis was advised. Hemoglobin electrophoresis is showing elevated fetal hemoglobin for the age of the patient. Elevated fetal hemoglobin at this age signifies that switch to adult hemoglobin, which occurs at birth and usually complete by 4 to 6 months, is still not complete, so a diagnosis of thalassemia is made. That's all for now in this video. If you have any queries or suggestions, then do post in the comment section below. If you haven't liked or shared yet, then do like and share this video, and don't forget to subscribe. Thank you.